Hello everyone and most welcome in my YouTube channel Medical Knowledge 360 degree, and in today's video we will discuss about some of the common and complex questions from fluid and electrolyte balance chapter. So without any further delay, let's get started. Our first question is: the nurse is caring for a client with heart failure. On assessment, the nurse notes that the client is dizzy and crackles are audible on auscultation. So, what additional manifestations would the nurse expect to note in this client if excess fluid volume is present? Your options are weight loss and dry skin, flat neck and hand veins and decreased urinary output, an increase in blood pressure and increased respiration, weakness and decreased central venous pressure. So what do you think? What is the right answer for this question? Here, the question says that there was a client with heart failure and the nurse assesses the patient, and on assessment the nurse found that the client is dysnic and crackles are audible on auscultation. So what do you think? What is the right answer for this question? So the right answer for this question is option third, that is an increase in blood pressure and increased respiration, because a fluid volume excess is also known as overhydration or fluid overload, and it occurs usually when intake or fluid retention exceeds the fluid needs of the body. That means when the fluid intake or fluid retention exceeds the amount the fluid needs in the body, then there will be overhydration or fluid overload occurs in the body. So the right answer for this question is an increase in blood pressure and increased respiration are the additional manifestations which a nurse expect to note in this client. Our next question is: potassium chloride intravenously is prescribed for a client with hypokalemia. So what is the demand of the question is that potassium chloride is administered to a client who is having hypokalemia. So which action would the nurse take to plan for preparation and administration of the potassium? Select all that apply. Your options are: obtain an intravenous infusion pump, monitor the urine output during administration, prepare the medication for bolus administration, monitor the IV site for signs of infiltration or phlebitis, ensure that the medication is diluted to in the appropriate volume of fluid, and ensure that the bag is labeled so that it reads the volume of potassium in the solution. So what do you think? What is the right answer for this question? Here, the question says that potassium chloride, that is KCl, is intravenously administered to a client who is having hypokalemia. So, what a nurse, being a nurse, what are the additional preparation which a nurse needs in the administration of the potassium? So, what do you think? What is the right answer for this question? Well, the right answer for this question is option first, second, fourth, fifth and sixth. Why? Because potassium chloride administered intravenously must always be diluted in IV fluid. That is the KCl is administered intravenously is always be diluted in IV fluid and infused via an infusion pump. Potassium chloride is never given by bolus, that is IV push. We never give potassium chloride in bolus form. Giving potassium chloride by IV push can result in cardiac arrest. So for this reason we never give potassium chloride in bolus or IV push form. We always diluted the potassium in IV fluid. The nurse should ensure here that the potassium is diluted in the appropriate amount of diluent or the fluid. The IV containing the potassium chloride should always be labeled with the volume of potassium it contains. The IV site is monitored closely because potassium chloride is irritating to the veins and there is risk of phlebitis. So for this the IV site is monitored very closely. In addition, the nurse should monitor for infiltration. The nurse monitors urinary output during administration and contacts the healthcare provider if the urinary output is less than 30 ml per hour. If the urinary output is less than 30 ml per hour, then the nurse must inform to the HCP, that is healthcare provider. Now, our third question is: the nurse is assessing a client with a suspected diagnosis of hypocalcemia. So, which clinical manifestations would the nurse expect to note in this client? Here, the nurse assesses a client who is having a diagnosis of hypocalcemia, that is, the amount of calcium in the body is low. So, what clinical manifestations would the nurse expect to note in this client? Your options are twitching, hypoactive bowel sounds, negative torso signs, hypoactive deep tendon reflexes. So, what do you think? What is the right answer for this question? Well, the right answer for this question is twitching. That is, we all know that the normal serum calcium level is 9 to 10.9 to 10.5 mg per dl. And when we talk about the in mole per liter, then the amount of the normal serum calcium level is 2.25 to 2.75 millimole per liter. A serum calcium level lower than 9 mg per dl indicates hypocalcemia. So, in this patient, there is hypocalcemia, that is, the normal calcium serum level is less than 9 mg per dl. So, what are the signs of hypocalcemia? So, there are some of the common signs which we observe in a patient of hypocalcemia, and these are like numbness, hyperactive deep tendon reflexes, positive Trousseau sign or Chvostek sign. Additional signs of hypocalcemia include increased neuromuscular excitability, muscle cramps, twitching, tetany, seizure, irritability, and anxiety. Also, gastrointestinal symptoms including gastric motility, hyperactive bowel sounds, abdominal cramping, and diarrhea. So, these are some of the common signs which we observe in a patient of hypocalcemia. So, the options which have been given, only one, that is twitching, shows the patient is having a diagnosis of hypocalcemia. So, the nurse expect in this client. Now, the question number 4 is, the nurse is reading a healthcare provider's progress notes in the client's record and reads that the HCP has documented insensible fluid loss of approximately 800 ml daily. The nurse makes a notation that insensible fluid loss occurs through which type of excretion. Your options are urinary output, wound drainage, integumentary output, the gastrointestinal tract. So, what do you think? What is the right answer for this question? Here, the question asks that a nurse is reading a healthcare provider's progress note and the client record. Here, the HCP has documented that insensible fluid loss of approximately 800 ml daily. So, the nurse makes a notation that insensible fluid loss occurs through which type of excretion. So, the right answer for this question is integumentary output. That is, insensible losses may occur without the person's awareness. So, when we talk about insensible fluid loss, the literally meaning of this is insensible loss occurs when the loss occur without the person's awareness. So, insensible losses occurs daily through the skin and through the lungs. Sensible losses are those of the person is aware, such as through urination, wound drainage, and gastrointestinal tract losses. So, the right answer for this question is integumentary output. Now, the question 5th is, the nurse is assigned to care for a group of clients. On review of the client's medical records, the nurse determines that which client is most likely at risk for fluid volume deficit. So, what do you think? What is the right answer for this question? Your options are a client with an ileostomy, a client with heart failure, a client on long-term corticosteroid therapy, a client receiving frequent wound irrigations. Here, the nurse is assigned to a group to care for a group of client, and on reviewing the medical records, nurse determines the client is most likely at risk for fluid volume deficit. So, the right answer for this question, a client with an ileostomy, because a fluid volume deficit occurs when the fluid intake is not sufficient to meet the fluid needs of the body. That is, the requirement of the human body or the body of the person or the patient doesn't meet, so then a fluid volume deficit occurs in the person's body. Causes of a fluid volume deficient include vomiting, diarrhea, conditions that causes increased respiration or increased urinary output, insufficient intravenous fluid replacement, draining fistulas, and also the presence of an ileostomy or colostomy. So a client with heart failure or on long term corticosteroid therapy, or a client having or receiving frequent wound irrigations, is most likely for fluid volume excess. Here the client is fluid volume deficient, so the right answer for this question is a client with an ileostomy. Now our sixth question is, the nurse caring for a client who has been receiving intravenous diuretics suspects that the client is experiencing a fluid volume deficit. So, which assessment finding would the nurse note in a client with this condition? Here, the nurse cares for a client who has receiving IV diuretics and the client is experiencing fluid volume deficit. So, which assessment finding would the nurse expect to note in this client? Your options are weight loss and poor skin turgor, lung congestion and increased heart rate, decreased hematocrit and increased urinary output, increased respirations and increased blood pressure. Well, the right answer for this question is weight loss and poor skin turgor, because a fluid volume deficit occurs when the fluid intake is not sufficient to meet the fluid needs of the body. And when we assesses a patient having fluid volume deficient, we found that the person having poor skin turgor, dry mucous membrane, weight loss, decreased urinary output, etc. are some of the common symptoms which usually found in a patient of fluid volume deficit. Now, as seventh question is, on review of the client's medical record, the nurse determines that which client is at risk for fluid volume excess. Your options are the client taking diuretics and has stenting of the skin, the client with an ileostomy from a recent abdominal surgery, the client who requires intermittent gastrointestinal suctioning, the client with kidney disease, and a 12-year history of diabetes mellitus. So, what do you think? What is the right answer for this question? Well, the right answer for this question is the client with kidney disease and a 12-year history of diabetes mellitus, because a fluid volume excess is also known as overhydration or fluid overload, as we all know, and it occurs when fluid intake or fluid retention exceeds the fluid need of the body. So the causes of fluid volume excess include decreased kidney function, heart failure, use of hypotonic fluids to replace isotonic fluid losses, and excessive irrigation of wounds, body cavities, and also the client taking diuretics, the client with an ileostomy, and the client who requires gastrointestinal suctioning are at risk for fluid volume deficit. So here the nurse determines that which client is at risk for fluid volume excess. So the fluid volume excess includes that the client who is having decreased kidney function or heart failure or use of hypotonic fluids or solutions. So the right answer for this question is 4, that is the client with kidney disease and a 12-year history of diabetes mellitus. So I hope this video may be helpful to you. If this video was helpful to you, then please let me know, and if you want this video lecture on in Hindi language, then let me know in the comment section so that I can prepare some future content on this channel. Thank you.